Hey, good afternoon. Welcome to the Hawaii State Senate Health Committee's 1 p.m. Health decision-making agenda. We have a number of agendas, so I'm just going to do our introduction once for the edification of the members and the public on the conference. I'm Jared Kehokalole, chair of the committee. I'm joined by my fellow Senate Health Committee members, Vice Chair Senator Rosalind Baker, Senator Sharon Moriwaki, Senator Kurt Favela, and we also have Senator Joy San Buenaventura, who we expect to join later. In the unlikely event that we must abruptly end this hearing due to major technical difficulties, the committee will reconvene to discuss any outstanding business on Wednesday, March 24th at 1:25 p.m. And a public notice will be posted on the legislature's website. For all of the members of the public on the conference who are here to testify, your audio and video will be disabled until it is your turn to testify. We have a number of different items on the agenda, and we are coming up on a deadline this week. So we would like to move as expeditiously as we can and vote out all these items at the conclusion of our 90-minute time slot here. So I would ask that you please respect our 2-minute individual testifier limit. We have received and read your testimony. So in the interest of time, I'd like to encourage you to use your allotted time to augment or clarify your remarks rather than reading your testimony verbatim, because we got it. You may also stand on your testimony, so it's up to you. And if there are temporary technical glitches during your turn to testify, we may move on, but we will try and come back to you and give you time to participate. On that note, we will move to our 1 p.m. decision-making on HB 1096 HD2. This is relating to parentage. My recommendation for this measure is to, after discussing this with the parties and going through the measure again, I think it is a worthy endeavor for us to try and do this right and comprehensively. So I'm going to recommend that we keep the task force and that we adopt the amendments of the advocates who sent in requests over the weekend that we add a member of Ka'ahamahu and a member of the Department of Health Sexual and Gender Minority Working Group. We also have some technical non-substantive amendments, and I'm going to recommend that we make this measure effective upon approval. Members, are there any questions? Okay, seeing none, Vice Chair HB 1096 HD2 passing with amendments. Chair votes aye. Vice Chair, you're on mute.
As well. Can you hear me now?
Yes.
Okay, for some reason, I've lost the actual video. Okay, Chair recommends that we pass House Bill 1096 with amendments. Chair voted aye. Vice Chair votes aye. Senator Moriwaki?
Aye.
Senator San Buenaventura? Excused. Senator Favela?
Reservations.
Chair, your recommendation is adopted. 3 ayes, 1 reservation, 1 excused.
Thank you very much. We're going to adjourn that 1 p.m. agenda, and it's 1:05 now. We are waiting on the Human Services Chair in order for us to open our joint committee hearing. So what I'm going to do right now is recess, and once we have the Human Services Chair with us, we will proceed with the rest of the agenda. Recess. Okay, good afternoon. We're going to convene this 1:05 p.m. joint agenda between the State Senate Health and Human Services committees to hear two bills. I'd like to thank my fellow chair for allowing us to do this today. The first measure on the agenda is HB 541 HD1. This measure relating to health. This establishes the State Payer Committee to be administered by the directors of the Departments of Health and Human Services or their designees to establish a purchase of service framework that aligns with all behavioral health and substance abuse service contracts. Let me see here. Okay, first up, we have the Department of Health and Support.
Good afternoon, Chair. Eddie Mercero, Department of Health. We stand on our testimony.
In support.
Thank you.
Thank you very much. Next, we have Department of Human Services MedQuest Division offering comments.
Hi, good afternoon. I was forgetting whether it was morning or afternoon. So good afternoon, chairs, members of the committee. Judy Moore Peterson, on behalf of the Department of Human Services, we stand on our written testimony, appreciating the intent and offering comments. Thank you.
Thank you very much. Also, we have the State Procurement Office, Ms. Kahakui, offering comments.
Good afternoon, chairs, vice chairs, members of the committee. Bonnie Kahakui for the State Procurement Office. We stand on our written testimony, providing comments and recommendations. Thank you.
Thank you very much. That's all the live testimony I can see here on the list. Is there anyone on the conference who would like to testify on this measure? Okay, seeing none, I'd like to note the written testimony in support from the Maui Mayor, comments on this measure from Focus, Dara Carlin in opposition, late testimony offering comments, the Hawaii Substance Abuse Coalition, and the Queen's Health Systems. So that's all the testimony we have on this measure. Members, are there any questions? Senator Moriwaki.
Thank you, Chair. I think it would be for Department of Health seems to be the fulcrum of this. Is Eddie? I thought I saw Eddie.
He's here.
Hi, Eddie.
Good afternoon, Senator.
Hi. I think this is a laudable bill, and I like it. It streamlines the process. Just a couple of questions. The one on Catholic Charities on, it seems like it's a 3-member committee. Is it going to be broader, or are you going to take, comments, or how is that going to work with all of the standards that you come up with?
Apologies, Chair. Are you referring to Catholic Charities
Testimony?
or?
Yeah. It's that they said, how are you going to consider the service provider and stakeholders currently with contracts? And I see that this will affect both renewables and new contracts, but also those that are continuing contracts. So how does that transition occur?
So under this measure, Senator, the primary goal or concept would be to just first and foremost get an assessment and an inventory of who's paying what to whom from a state payer perspective. There wouldn't necessarily be any initial changes in contracts or any of those, especially in current contracts. So it'd just be first and foremost getting an inventory. If there was a need to, which is part of why this, the recommendation would be to move it from 103F statute into 321 statute. The goal would be to assure that we were working with the State Procurement Office if we were needed to change any current contract language or any of that kind of stuff.
Thank you. And just one more thing. So it looks like there is a July 21 effective date. And I'm just wondering whether all of that will be done by July of this year. So I'm just questioning the timeline.
So under the current measure, the July 21 effective date would be when we would start the payer committee and actually start the work. And so you're exactly right, Senator. There is a lot of work to be done under this kind of measure or approach. I think it's very worthwhile work for us to do as state funders to really start to kind of get more transparency again on who's paying what to whom for what services, and be able to coordinate those services more effectively and those resources more effectively. So, but the current measure really just, the way I understand it, really just asks for us to start the committee in July 21.
Okay, great. No, I think it's a great idea, great plan. And if it's just a start date and not some kind of being put in place, I think it's very good. Thank you. Thank you, Chair.
Thank you, Senator.
Members, any other questions? Okay, seeing none, we'll move to the next measure on the agenda, HB 882 HD1, relating to procurement. This requires purchasing agencies to make a written determination that the amount of a contracting action for purchase of health and human services is fair and reasonable. It also amends the selection process and composition of the procurement policy board, and amends the circumstances for when treatment services may be purchased, and repeals the establishment of the Community Council on the purchase of health and human services. First and only live testifier we have is the State Procurement Office in support.
Good afternoon again, chairs, vice chairs, members of the committee. Bonnie Kaukoi for the State Procurement Office. We stand in strong support of this bill. Thank you.
Thank you very much. So that's all the live testimony we have. Is there anyone on the conference who would like to testify on this measure? Okay, so I'd like to note for the record, Catholic Charities of Hawaii, Focus, and the Hawaii Substance Abuse Coalition all submitted testimony on this measure offering comments. Members, are there any questions for the State Procurement Office?
Chair, Kyoho Kalole.
Senator Ocasio.
I have a question for the Procurement Office, being that they're the only folks here, but my question would be, why would you folks want an even number, voting number in this situation?
I don't actually think that we were considering even numbers or odd numbers. What we were trying to do is reduce the board so that we can get quorum. Right now, it's been very, very difficult to get quorum. So if we thought if we reduce the number, at least we have a fighting chance.
Okay, thank you.
Members, Senator Moriwaki.
Just to add to that, because the procurement council is important, it's statewide and it includes the counties. I'm just wondering to SPO again, Bonnie, is the composition in terms of the representation on the board as you're amending? I know you're amending the numbers, but in terms of reflecting what you need to look at a lot of these policies that we're trying to change in these days to come, that it truly represents all the affected organizations or jurisdictions.
Again, we didn't change the composition as much as the numbers. So we still do have representation from the health and human services sector.
But you're also adding that they have professional expertise, right? Isn't that?
Well, originally the bill said it had to be certified. And that was a very nebulous word. What is a certified person? So we took out the certification title on that, and we just want someone with experience in this field of health and human services.
Thank you, Chair.
Thank you.
Members, any other questions?
I have a question.
Senator Ihara.
Procurement Office, the quorum stays the same. From a quorum of 5 is 3, a quorum of 4 is still 3. So I'm not sure why. I mean, I don't understand. Can you explain?
I guess we'll have to take a look at that, but we are not even able to get people to fill the vacant positions at all.
Okay. But you understand that
Yes,
four-member board, the quorum is still 3.
yes, I understand that. Thank you.
So
But we can't even get people to apply, much less the governor to make the appointments. So we can't even get members, period. Thank you. But I will look into that.
Sure.
Okay, members, any other questions? Okay, seeing none, rather than vote on these, Chair, would you like to go through your 115 agenda and then we vote on everything at the end?
Sounds good.
Okay, so we'll defer the decision making on this 1:05 p.m. agenda until we've heard all the testimony on the 1:15 p.m. agenda. And I will turn it over to the Human Services Chair when she is ready.
Okay, so sounds good. Calling the hearing on the Committee on Human Services and Committee on Health. Prior comments by Health Committee regarding the videotaping of the video testimony and of this hearing is not going to be repeated. And I believe we have for Human Services, we have Senator Bennett Misalucha, Senator Favela, Senator Ocasio, and Vice Chair Les Ihara, as well as myself on present. Okay, and so first up, HB 345, relating to assisted community treatment, mandates appointment of a guardian ad litem to represent the best interests of a mentally ill individual in assisted community treatment proceedings. First up is, okay, I believe it's the Governor's Coordinator on Homelessness. Are they present? No. Okay, next is Luis Erestechek, Hawaii Disability Rights Center for comments. Are you present?
Yes,
Okay,
thank you.
please proceed.
Okay, thank you. I think the appointment of a guardian ad litem was a great idea, and so and we think that would definitely give the court some insight into what the best interests of the respondent would be. Maybe it's because I'm a lawyer, but I continue to have concerns about the original version of this bill, as well as the Senate Companion 199 that passed out, which eliminates the public defender. Which is not to say that non-lawyers don't want to protect the rights of defendants, but it's sort of ingrained in me as a lawyer that this is a legal proceeding, and the complaint seems to be that the public defender is doing too good of a job and somehow gumming up the works when everybody's trying to help these people. And I understand that, but I guess I was involved when the law first went into place. And one of the compromises was that there would be a right to counsel for these people. And in theory, if the case is good, they should be able to prove the case and get the relief that they want. And I also thought that there was money appropriated by the legislature so that people would have access to lawyers. But that said, it looks, reading the testimony, more and more people seem to be coming to the view that maybe they should get rid of the public defender and just have a GAL. And if the legislature wants to go that way, it's a policy decision, obviously. But that's our perspective is to still be cautious about legal rights that people have, especially vulnerable people with disabilities. So I would urge you to caution, certainly. Thank you.
Okay, thank you very much. Next up, Office of the Public Defender. Are they present?
Yes, we are.
Okay,
thank you.
Please proceed.
Thank you, Chair. Good afternoon, chairs, vice chairs, and members of the two committees. My name is James Tabe. I'm with the Office of the Public Defender. We have provided comments, but I would like to add a few things. I believe the intent of this bill, the underlying intent of this bill is to expedite the assisted community treatment process. I think this bill in its amended form will not do anything to speed up the process. Currently, the GALs are currently all cases, a GAL is already appointed. That's one of the first things that's done at these proceedings. I just want to let you know some facts here. This morning, a 3-day hearing was scheduled to commence on an ACT petition. This petition was actually filed back in June 2020. So it's actually taken over 8-9 months just to get a hearing date finally set, as well as the hearing was going to take 3 days long. There's also another case petition was filed in January, and the hearing date is scheduled to be in May, barring any continuances that may occur. So basically, it's just that the Public Defender's Office will continue to represent these people, but I just let you know there are circumstances when we're involved, the process does slow down quite a bit. And as I mentioned in toward the end of my written testimony, it does preclude a whole class of people from filing these petitions, private persons, because it's just, attorneys are just not affordable. Other than that, I am here for questions. Thank you very much.
Okay, thank you very much. Okay, next up, Department of Health. Is anyone from Department of Health present?
Yes, good afternoon, chairs, vice chairs, members. My name is Michael Champion. I'm the medical director of the Department of Health's Adult Mental Health Division. The Department of Health stands on its testimony in support of this measure and will be available for any questions if they may arise. Thank you.
Okay, next up, I don't know whether or not they signed up, but City and County of Honolulu Prosecutor's Office in support. Okay, they're not present. About HSAC, Hawaii Substance Abuse Coalition, comments. Partners in Care and Support. Anybody else here present for HB 345? Okay, seeing none. The written comments have been made by the judiciary. Carolyn Kunitake in support. Ellen Godby Carson in support. Okay, anybody else wishing to testify in HB 345? Seeing none. Questions? Okay, seeing none, we're moving on. HB 474, relating to hospital sustainability program, extends the hospital sustainability program through June 30, 2024, increases the maximum fee for inpatient care services to 5.5%, increases the amount of time hospitals have to pay the hospital sustainability fee from 30 to 60 days, increases the pool of Medicaid services that can be used for matching purposes. Okay, first up is Hawaii Primary Care Association. Are you present? Okay, moving on. Adventist Health and Kaiser Permanente, and I thought I saw Hilton Rayfield there for HA. Are you present? Anybody else wishing to testify in HB 474?
Yeah, thank you. Chair, Vice Chairs, members of the committee. My name is Hilton Rayfield, Presidency of the Healthcare Association. The Healthcare Association of Hawaii stands in strong support of HB 474 HD2, and we stand on our written testimony. Thank you.
Okay, thank you.
Hi, this is Judy Moore Peterson on behalf of the Department of Human Services. I apologize if you did not have our written testimony. So we also stand on our written testimony in strong support of House Bill 474. Thank you so much.
Yeah, I believe we got your late testimony about your proposed effective date and, okay, and the amount of monies. Any other, okay, thank you. Anybody else wishing to testify on HB 474?
Committee members, J.C. Mike Kielonic for the Queens Health Systems. We'll stand on our written testimony in very strong support of this measure. Thanks very much.
Okay, thank you very much. Okay,
strong support.
So Michael Robinson, who are you testifying for? Yourself. Okay, Hawaii Pacific Health. Okay, anybody else wishing to testify on HB 474? Okay.
Chair, Jonathan Ching for Kaiser Permanente. We will also stand on our testimony in strong support. Thank you.
Okay, thank you very much. Okay, I thought I said Kaiser, sorry. Anybody else wishing to testify on HB 474? Okay, seeing none. Members, any questions? Okay, I have a question for Hilton. Hilton, are you ready? Are you there?
Yes.
Okay, did you see Judy Moore Peterson's late testimony as to the effective date and the money amounts? And are you agreeable to that? I believe it is, I believe it's like over 300 something thousand, because I'm going to amend the blank amount to Judy's amounts. Oh yeah, she didn't post it online. I see. Okay. I'll have Judy. Judy, are you still on?
Yes, I am, and it's from the original bill. It's both the date and the amount are from the original bill, and they got defected, through the process. They got blanked out, or the dates were put in as a.
Okay. Do you remember how much it is? Because
$325 million.
325 million.
Yes.
And what's the effective date?
Hang on one second.
That was June something.
It is June 29th of 2021.
2021. Okay, so let's go back to Hilton, Kaiser, and Hawaii Pacific Health. Do you folks have any problems with those amounts?
This is Hilton. We are fine with those amendments. Thank you.
Okay, sounds good. Kaiser and Hawaii Pacific Health, are you folks fine with those amendments? And Queens? I'm going to assume with the silence that you folks are in agreement. Okay, any other questions from committee members? Okay, seeing none, I guess we recess for decision making.
Yes.
IT.
Okay, thank you everyone for your patience. We are going to reconvene the 1:05 p.m. joint agenda between the Health and Human Services Committees to vote on two measures. The first, HB 541, related to the State Payer Committee. I appreciate the dialogue that we've had over the multiple hearings on this issue. And as the Department of Health noted when they testified, the intention of this bill really is just to make sure we know who is paying what to do what, and about being intentional with the contracting of services for behavioral health care, mental health, substance abuse, homelessness. So what I'm going to recommend we do, members, is that we delete the contents of this bill and we reconstitute the Act 263 working group from 2019. which was the Integrated Behavioral Healthcare System Working Group. And that we amend that working group to establish a new purpose, which includes identifying gaps, coordinating funding sources, and establishing and identifying outcome measures for behavioral health, substance abuse, and homelessness. I'm also going to recommend that we amend the membership of that working group in the following ways. We are going to replace the Opioid Initiative Steering Committee member with the Governor's Coordinator on Homelessness. We're going to add a member of the UH Psychiatric Department with ASAM affiliation. That's the Academy of Substance, I'll get it. It's ASAM affiliations. And it was recommended by the Hawaii Substance Abuse Coalition to ensure that we had membership on the group that was properly familiarized with evidence-based approaches. We're going to add a member of the Office of Hawaiian Affairs, and we're going to make the date effective upon approval. Members, are there any questions? Okay, seeing none, Vice Chair HB 541 passing with amendments. Chair votes aye.
Pass House Bill 541 with amendments. Chair votes aye. Vice Chair votes aye. Senator Moriwaki. Senator Moriwaki. Excused. Senator San Buenaventura.
Aye.
Senator Favela.
Aye.
Chair, your recommendation's adopted.
Thank you. Chair San Buenaventura.
Sorry. For Human Services, Senator Misalucha is taking our vote. Same recommendation. For HB 541. Senator Misalucha.
Okay, for Committee on Human Services for HB 541 HD1, Chair recommends pass with amendments. Chair votes aye. Vice Chair Ihara.
Aye.
Senator Akasho.
Aye.
Senator Misalucha votes aye. Senator Favela.
Aye.
You have 5 ayes, Chair. The recommendation's adopted.
Thank you very much. Thank you, Chair. ASAM is the American Society of Addiction Medicine, just to note for the record. The next measure is HB 882. This repeals the Community Council on Purchase of Services, a purchase of health and human services. The recommendation here is to accept the requested amendment by Catholic Charities, adding a member of HANO or Focus to the board so that the nonprofit community has direct access on the council. We also have some technical non-substantive amendments. Members, are there any questions or comments? Okay, seeing none, Vice Chair HB 882 passing with amendments. Chair votes aye.
Chair votes aye. Vice Chair votes aye. Senator Moriwaki. Excuse. Senator San Buenaventura.
Aye.
Senator Favela.
Aye.
Chair, your recommendation's adopted.
Thank you very much.
For Human Services Committee, same recommendation. Senator Misalucha, Chair votes aye.
For Committee on Human Services, as regards to House Bill 882 HD1, Chair recommends pass with amendments. For all members present, are there any reservations? Any nays? You
Reservation.
have 5. Oh, reservation. Okay, so you have 4 ayes, 1 reservation. The recommendation's adopted, Chair.
Okay, thank you very much.
Thank you very much, members. Our 1:05 p.m. agenda is adjourned.
So for reconvening the 1:15 agenda for the Committee on Human Services, Committee on Health joint with Committee on Human Services as lead. For HB 345, Chair's recommendation is to remove all references to guardian ad litem and substitute an existing guardian, and various amendments basically requiring the judge, in the event that there is no guardian ad litem appointment, to look at an existing guardian or appoint the public guardian. We're going to keep the defective date, but we're also going to remove the public defender to expedite the ACT process. Any questions, committee members? Okay, I can't see if anyone is raising their hands, so they need to speak up if there's any questions. Sorry. Okay, seeing none, Senator Misalucha for the vote.
This is for Committee on Human Services as regards to House Bill 345 HD2. Chair recommends pass with amendments. Senator Benaventura, Chair votes.
Aye.
Senator Ihara.
Aye.
Senator Cascio.
Aye.
Senator Misalucha votes aye. Senator Favela.
Aye.
You have 5 ayes. Your recommendation's adopted, Chair.
Thank you very much for health.
Health Committee, same recommendation. Chair votes aye.
Pass with amendments, Chair votes aye, Vice Chair votes aye. Senator Moriwaki. Excuse, Senator San Buenaventura.
Aye.
Senator Favela.
Aye.
Chair, your recommendation's adopted.
Thank you very much.
Thank you very much. So for HB 474, Chair's recommendation is to accept MedQuest's late testimony on suggested amendments. Basically, it's to revert the amounts back to original form instead of a blank appropriation. Per testimony, it should be 325 million and an effective date of June 29, 21. There are no general funds for the sustainability program, and it basically is them paying themselves. Any questions? Again, please speak up if you do. Okay, seeing or hearing none, Senator Misalucha for the vote.
For House Bill 474 HD2, Chair recommends pass with amendments. For all members present, all 5, are there any reservations? Any nays? You have 5 votes. Your recommendation's adopted, Chair.
Okay, thank you very much, and we're adjourned for the 1:15 calendar. Oh, not yet. Sorry.
Hold on, Chair.
Health, sorry.
Almost there. Health Committee, same recommendation. Chair votes aye.
Chair votes aye, Vice Chair votes aye. Senator Moriwaki. Excuse, Senator San Buenaventura.
Aye.
Senator Favela.
Aye.
Favela. Thank you. Chair, your recommendation's adopted.
Thank you very much.
Okay, now we can adjourn. Okay, thank you very much.
Okay, and so with that, thank you, members of the Human Services Committee, for joining us. We are now going to gavel into our 1:20 p.m. Health Committee agenda to hear 3 bills. The first measure on the agenda is HB 224, relating to the State Health Planning and Development Agency. This exempts psychiatric services, special treatment facilities, and chronic renal dialysis services from the Certificate of Need requirements. It also authorizes administrative penalties for persons who do not comply with an approved Certificate of Need. It also appropriates funds from the Health Planning Development Fund. First up, we have offering comments, the State Health Planning and Development Agency.
Good afternoon, Chair, Vice Chair. We stand on our testimony providing comments, and we also support the amendments proposed by the healthcare providers regarding the health services and facilities plan, which will improve SHPDA's ability to develop and revise the plan in a timely manner, thereby strengthening the CON process. Thank you.
Thank you very much. Next, we have Hawaii Pacific Health in support.
Good afternoon, Chair, Vice Chair. Mike Robinson, Hawaii Pacific Health. We support this measure, and we also have provided proposed amendments that we believe will help SHPDA with their planning function that we asked this committee to consider. This was proposed language developed by Hawaii Pacific Health, Queens, Kaiser, Ohana Pacific, And we also introduced it in front of the HAH Association. So we ask that the committee consider our amendments, and I'll be available for any questions. Thank you.
Thank you very much. Testifying for the Institute for Justice, Jamie Kavanaugh, in support.
Good afternoon, Mr. Chair, Madam Vice Chair, and the committee. My name is Jamie Kavanaugh, and I'm offering testimony on behalf of the Institute for Justice. The Institute for Justice supports this measure and has worked for decades to end certificate of need laws. This past summer, I authored a report that compares con laws around the country and reports what measures each state took in response to the COVID-19 pandemic. The pandemic really laid bare the existing problems with con laws. Proponents of con laws often argue that these laws offer increased access to care, decreased costs, and higher quality care. While this has been disproven by academic research, it was also disproven by the pandemic. If con laws actually created greater access to healthcare, you'd expect that states would want more of these laws during the pandemic, but the opposite was true. Me and my co-authors found that 25 out of the 39 jurisdictions with con laws in the United States were forced to quickly suspend their con programs in some manner to respond to the pandemic. Here, for instance, the Department of Health invoked existing regulations that allow for expedited con application review during emergencies. And the fact that con laws are harmful is not just my conclusion. Agencies of the federal government have consistently disavowed con laws since the 1980s. And in 2015, the FTC and DOJ issued this joint statement, quote, "It is now apparent that con laws can prevent the efficient functioning of healthcare markets in several ways. First, con laws create barriers to entry and expansion, limit consumer choice, and stifle innovation. Second, incumbent firms seek to thwart or delay entry by new competitors may use con laws to achieve that end. And finally, the evidence to date does not suggest that con laws have generally succeeded in controlling costs or improving quality." Thank you for considering this testimony.
Thank you very much. Next, we have for Satellite Healthcare, Blake Oshiro in support.
Blake Oshiro, on behalf of Satellite Healthcare, we stand on our written testimony in support and are available for any questions. Thank you.
Thank you very much. Department of Health in support.
Good afternoon, Chair, Vice Chair, members of the committee. Lauren Kim from the Department of Health. We support a bill relating to SHPTA moving through the legislature. The budget has not been decked. As a matter of executive branch policy, the governor's recommendation in the Biden budget is to reduce. And so this bill as a vehicle for policy and budget deliberations is important. So we don't take a strong position on its specific contents, but hope that this remains alive while the budget negotiations continue. Thank you for the opportunity to testify.
Thank you very much. Healthcare Association of Hawaii in support.
Good afternoon, Chair. I apologize. I don't seem to be able to turn on my video. Oh, I'm being pushed. Okay, thank you, Chair. Thank you, Vice Chair, for the opportunity to testify. We are in support of the amendments offered by the provider community. Those amendments are included in the testimony of HPH, Makua, Kaiser, among other providers, and we are in support of the measure with those amendments. Thank you.
Thank you very much. Kaiser Permanente offering comments.
Aloha, Chair. Jonathan Ching for Kaiser Permanente. In the interest of time, we will stand on our testimony, offering comments and requesting the committee consider the amendments offered forward by the provider community.
Thank you very much. Liberty Dialysis in opposition.
This is Marilyn Matsunaga. Thank you so much for this opportunity to testify today. Some years ago, I was the SHPTA administrator and managed the Certificate of Need program. My dad spent the last 3 years of his life on dialysis with St. Francis, and Liberty Dialysis, which is its successor organization, asked me to help them with this legislation. Just two items that we're asking to be amended. One is the proposed fee to appeal SHPTA decisions. We believe this is overly protectionist of SHPTA. And the second is to amend the bill by deleting the exemption for chronic renal dialysis care. We believe that dialysis providers, as all providers in Hawaii, should meet the Certificate of Need regulatory standards. Hawaii consistently ranks at the top of healthcare rankings in the United States. And I believe it's because we have the Certificate of Need program on the one hand, that's looking at access to our facilities and services. And on the other hand, we're the only state with employer mandated healthcare insurance, which pays for all of these services and facilities. Together, they are the foundation of a very effective healthcare system. And I hope that they will continue to care for us far, far into the future. Thank you so much.
Thank you very much. Next, Wesley Lowe in support.
Mr. Chair, Madam Vice Chair, Wesley Lowe, representing Ohana Pacific Health and Halemakua Health Services. I stand on my written testimony in support with amendments provided by the provider community. Thank you.
Thank you very much. That's all the testimony that I see here by individuals who indicated they would be present. Is there anyone else on the conference who would like to testify?
Mr. Chair, J.C. Mike with Queens Health System. I apologize. We submitted late testimony, but we support the measure with the amendments as proposed by HPH and others in the provider community, and we appreciate your time. Thank you.
Thank you very much. Is there anyone else that I missed that would like to speak on this measure, HB 224? Okay, seeing none, I'd like to note the written testimony offering comments from the Grassroots Institute of Hawaii, supporting testimony from HMSA, comments from AMR, the HGEA, the Hawaii Primary Care Association, opposition testimony from Laura Colbert, Patrick Bolin, Loma Hassel, and Maria Garcia, and testimony in support from Emmeline Kim. Did I miss anyone on this measure? Okay, that's all the testimony I believe we've received. Members, questions? Okay, seeing none, we're going to move to the next measure on the agenda, HB 1322. Relating to trauma-informed care, this establishes a trauma-informed care task force within the Department of Health to make recommendations of trauma-informed care in the state. First up, we have the Department of Health.
Hi, good afternoon, Chair, Co-Chair, and committee members. I'm Scott Shimabukuro with the Department of Health, Child and Adolescent Mental Health Division. We stand in strong support of this bill with recommendations. We're asking for an additional year to complete the effort of the task force. The scope of the task force is quite large, and we believe that adding time would allow for recommendations to translate from an abstract theoretical exercise to operationalize actual practices by the system in its day-to-day activities in our communities. And in order to accomplish this behavior change across the state will need that additional time, though extra time does not prevent the task force from submitting an interim progress report. So I'd like to thank you for your time and consideration.
Thank you very much. Next, we have DHS in support.
Aloha, Chair, Vice Chair, and committee members. My name is Catherine Korinaga here on behalf of Director Kathy Betts. The department stands on its written testimony of support. Thank you for this opportunity to testify.
Thank you very much. Hawaii Pacific Health in support.
Mike Robinson, HPH, and Kapiolani Medical Center will stand at our written testimony in support.
Thank you very much. That's all the testimony we've received on this measure by individuals who indicated they would be present. Is there anyone else on the conference who would like to testify? Okay, seeing none, I'd like to note the written comments of the Department of Agriculture, supporting testimony from the Office of Hawaiian Affairs, the Executive Office on Early Learning, the Hawaii Community Foundation, the Hawaii Primary Care Association, and Judith Clark. Members, are there any questions? Okay, seeing none, we're going to move to the last item on the agenda, HB 471, relating to behavior analysis analysts. This makes permanent the regulation of behavior analysts. Testifying first for the DTCA Professional and Vocational Licensing Division and Support, Ms. Kyoki.
Good afternoon, Chair, Vice Chair Lonnie Kyoki, Licensing Administrator of the Professional and Vocational Licensing Division. The department will stand on its written testimony in support of this measure. Thank you.
Thank you. Department of Education in support.
Good afternoon, Chair Keoho Kalole and Vice Chair Baker. I'm Heidi Armstrong, Department of Education, testifying on behalf of Superintendent Kishimoto, and the department stands on its written testimony in support. Thank you for the opportunity to testify.
Thank you. Hawaii Association for Behavior Analysis in support.
Good afternoon, Chair, Vice Chair, and members of the committee. Deborah Krekel on behalf of Hawaii Association for Behavior Analysis. Thank you for the opportunity to testify on this measure and for your continued support of our Keikian families. We stand on our written testimony in strong support, and we respectfully request a clean date of June 29, 2021 to ensure the regulation does not lapse. Thank you.
Thank you very much. The Hawaii State Teachers Association in support.
Good afternoon, Chair Keoho Kalele and Vice Chair Baker. We appreciate your support. Speaking for Corey Rosenlee of Hawaii State Teachers Association, we support this measure. Please make this permanent. Thank you.
Thank you very much. And testifying in support, Kristen Koba-Burt.
Thank you, Chair, Vice Chair, members of the committee. I'll just echo HSTA's testimony as well as HABA's to please make this a permanent regulation. Thank you.
Thank you very much. That's all the testimony we received from individuals who indicated they would be present. Is there anyone else on the conference who would like to testify? Okay, seeing none, we also have written testimony in support from the Department of Health, the Hawaii Disability Rights Center, the Council of Autism Service Providers, Together for Our Keiki, and individual testimony in support from Marchett Fulham, Dallas Starr, Rachel Miller, Eliza Lip, Miley Martin, Aaron Walters, Joslian Miller, Pamela Wood, Jeffrey Krebs, Deborah Krekel, Brian Burt, and late testimony in support from Roxanne Bristol, Kyle Machos, Cheryl Ebisui, and Alyssa Harris. Members, are there any questions? Okay, seeing none, we're going to recess for decision making. Okay, reconvening our 1:20 p.m. March 22nd agenda to vote on 3 measures. The first is House Bill 224. This is relating to the State Health Planning Development Agency. I'm going to recommend first that we adopt the suggested amendments by the healthcare community requiring the State Health Services and Facilities Plan to be updated every 5 years. I'm going to recommend we also remove the fee for appeal. And because of the request of the Department of Health, and I think the need for us to, at least for now, keep the discussion moving, I'm going to insert Section 2 of Senate Bill 1231. So this allows either the Department of Health or SHPTA to facilitate the purposes of the statute for discussion purposes. I would note that the date on this measure is defective. SMA, do we have text on this?
Yes, Senator.
There are also some technical non-substantive amendments that we'll be making to the measure. Members, any discussion? Okay, seeing none, Vice Chair HB 224 passing with amendments. Chair votes aye.
Vice Chair votes aye. Senator Moriwaki. Excuse. Senator San Buenaventura. Senator San Buenaventura. Okay, excuse Senator Favela.
Reservations.
Okay. 2 ayes, 1 with reservations, to excuse, measures adopted.
Thank you very much. Next measure, HB 1322. This is related to the Trauma-Informed Care Task Force. I'm going to recommend that we accept the Department of Health recommendations on the timeline. I think it's, it's a worthwhile and important effort, and so we should do it right. I'm also going to recommend that we make some changes to the composition of the membership of the group so that we can facilitate the most effective and expeditious work on this. So I'm going to recommend we remove the Department of Labor, the Department of Agriculture, the DCCA, the counties, the consumer advocates, the Office of Hawaiian Affairs, and the legislative representatives from the group. I think they're all notable, but there are just way too many people on this group for it to be effective. But I am going to recommend that we add a member of the Department of Public Safety or designee and a member of law enforcement. We also have some technical non-substantive amendments, and I'm going to recommend that we make the date of this measure effective upon approval. Any discussion? Okay, seeing none, Vice Chair, HB 1322, passing with amendments. Chair votes aye.
Vice Chair votes aye. Senator Moriwaki. Excuse. Senator Sam Buenaventura. Excuse. Senator Favela.
Aye.
Thank you. Chair, your recommendation is adopted.
Thank you very much. Last measure on the agenda, HB 471, relating to behavior analysts. I'm going to recommend that we make the date on this measure effective upon approval. We also have some technical non-substantive amendments. Any discussion? Okay, seeing none, HB 471, passing with amendments. Chair votes aye.
Vice Chair votes aye. Senator Moriwaki. Excuse. Senator Sam Buenaventura. Excuse. Senator Favela.
Aye.
Thank you, Senator. Chair, your recommendation is adopted. 3 ayes, 2 excused.
Thank you very much. Members, I'd like to note we have a 3 o'clock and a 3:10 agenda, joint agendas with multiple other committees. Thank you very much. We are adjourned.